Good afternoon. I am Dr. Amit Haldar. I am consultant neurologist at Fortis Hospital in Calcutta. Today I am going to tell you certain facts about pediatric epilepsy. Epilepsy, as we all know, means two or more unprovoked seizures. So epilepsy and seizures are not same. One has to have more than one seizure to say that someone has got epilepsy. Now, why do I stress on the point pediatric epilepsy? Most of the neurological disorders occur in elderly people like stroke, dementia, Parkinsonism. Epilepsy is different in that two-thirds of the epilepsy patients start in the first 20 years of life, and 40% of the epilepsy patients have their first convulsion or seizure within the first 15 years of life. So it is disease of the young, and that's why pediatric epilepsy is very important, because it affects persons in their most productive and learning years of life, and this can have an impact for the future duration of the individual. Now, what causes epilepsy? In pediatric epilepsy, there are several important causes. Most important and preventable cause is injuries suffered to the brain during childbirth, which we call perinatal injuries, birth injuries. They can be trauma, they can be due to lack of oxygen or due to low blood sugar and low calcium. So all these perinatal injuries can lead to development of epilepsy in later life, especially during early childhood or even during adolescence. Another important cause is the infections. Infections occur across all age groups, but especially in the developing world and in countries like India, infections like neurocysticercosis and tuberculosis are rampant. Neurocysticercosis is caused by a worm called Taenia solea, and which produces cysts in the brain and leads to epilepsy or acute symptomatic seizures. Tuberculosis, many viral encephalitis, all these are common causes of epilepsy even in the pediatric age group, and most of these are preventable. Another important cause of epilepsy are the structural malformations of the brain. The child is born with a malformed brain, and epilepsy starts within the first few years of life. The metabolic disorders, some of which are genetically transmitted, can also lead to epilepsy. And apart from these, certain chromosomal translocations, and as I said, structural malformations of the brain like cortical cysts can cause epilepsy. Brain tumors can cause epilepsy both in the young as well as in the adults. Stroke, which is a common cause of epilepsy in adult life, can cause epilepsy even in pediatric age group. In the young adults or even in late adolescence, drug abuse and substance abuse is also becoming a common cause of epilepsy. Now, so with proper care during childbirth and prevention of infections, we can save the development or prevent the development of epilepsy in lot of young children. Therein lies the importance of health education and proper health care. Now, what are the types of epilepsy? Epilepsy can be classified into many types. The commonest classification is based on the type of seizures. If the convulsion starts from both sides of the brain simultaneously, we call it generalized epilepsy. If on the other hand, the convulsion starts from one part of the brain and then spreads or remains limited to that side of the brain, then we call it focal or partial epilepsy. Now, importance is, if you classify the epilepsy in this way, we know the treatment of the two conditions may vary. Another way to classify pediatric epilepsy is depending on the severity of the illness. There are certain devastating epilepsy syndromes which we call epileptic encephalopathies, which develop in young children. In infancy, one of this is the West syndrome. In in between the age of 3 to 8 years you develop what is known as Lennox-Gastaut syndrome, and even in neonates you have certain devastating syndromes like the Otahara syndrome or the severe early myoclonic encephalopathy. All these devastating epilepsy syndromes not only produce epilepsy, but they also produce neuroregression or lack of development of milestones, and ultimately leaves the child mentally challenged. On the other hand, there are certain epilepsy syndromes which are relatively benign, and which if you treat them properly, the child will become normal and can lead a normal life. So some of these include the childhood absence epilepsy, the juvenile myoclonic epilepsy, the benign Rolandic epilepsy. In benign Rolandic epilepsy, you get seizures mostly out of sleep, and this is an age specific epilepsy syndrome which usually starts at around age of 5 or 6 years and ultimately ceases to occur at around the age of 16 years. The childhood absence epilepsy, where you present with eye blinks or repeated episodes of unresponsiveness, responds very well to medicines like sodium valproate or ethosuximide, and they may stop in later life. Juvenile myoclonic epilepsy usually starts at around adolescence or just after adolescence, and they present with myoclonic jerks or brief jerks on waking up in the morning. Later they may develop generalized convulsions, and this syndrome also usually responds very well to medicines, but some of them, for some of them you cannot stop the medicines, and this syndrome continues in adult life. Now all these syndromes, so you can see they vary in prognosis, so you have to investigate them properly and identify what type of epilepsy the child has got. For investigation, you can do an EEG, which is an electroencephalogram, where you apply electrodes on the surface of the brain and then record the electrical activity. Imaging modalities like CT scan, MRI, brain can help, but the most important and the most neglected point is the description of the seizures. So you have to record the seizures. That is the best way to describe a seizures. You can use even a home camera, video camera to record it. Otherwise, there are now EEG instruments with a video camera which can record the seizures. The seizure description has to be taken from an eyewitness of the seizure. So whenever you see a child having a seizure, try to note from where the seizure is starting, whether the child loses consciousness or not, and how long does it take for the child to regain consciousness, and even if he is conscious, does he become normal, is he having any abnormal movements of the eyeballs or of the lips, etc. Now after you have identified the seizures, you have to treat them. So the most important treatment is the medicines. There were 4 or 5 epilepsy medicines which were available till the 1980s, but from the 1990s a lot of new epilepsy medicines have come, and some of them are approved for use in pediatrics. More than dozen anti-epileptic medications have come. These medicines have much lesser side effects and they are very useful. They are all very effective if you use them properly in proper dosage. But before using them, you have to know what is the side effect of the medicine. So if a child has epilepsy, you have to know when the doctor is prescribing a medicine what can be the side effects. Because some of these medicines can produce liver problems, some can produce skin rash or drowsiness, some can even lead to irritability and mood fluctuations. Now what happens if the medicines don't work? In 70% of the epilepsy patients, medicines work very well, but in 30% it doesn't. So in those 30%, nowadays epilepsy surgery is coming up. Now for epilepsy surgery, you have to have a focal lesion in the brain, otherwise it becomes very difficult. and if epilepsy surgery is planned, it can be done even in the pediatric age group. And these are done mostly in cases where medicines don't work, that is, the child is refractory to medicines. Now, if your child has got refractory epilepsy but is not a surgical candidate, then what can you do? There is hope for even those patients. There is a new form of treatment, a diet therapy called ketogenic diet, which has been started, and here the diet is rich in fat, low in carbohydrates. That can also help in patients who don't respond to medicines. Now, apart from these, a lot of things about epilepsy are unknown. Firstly, when a child has a seizure, what should be the first aid given? The child should be left alone, or the child should be attended? Should someone poke a spoon in the mouth of the child, or pour water on him? No one knows. So the best thing to do when a child has a seizure is to make him lie comfortably or turn to one side so that the secretions come out from the mouth. If he is wearing some tight clothes, just remove it. And if the convulsion continues beyond 3 minutes, you should always contact the ambulance. There are certain also emergency medicines available which can be given to the rectal route or the nasal or buccal mucosa, through the buccal mucosa, which you should ask your doctor about. Now, apart from the treatment, there are certain other aspects of epilepsy in childhood that one should remember. One of these is to inform the school. If your child has epilepsy, the teachers should be informed, because then they will know what to do in case the child has a convulsion. Second thing is to if the child is going to swim, you should be very careful, but don't prevent him from taking part in normal activities, because if you restrict the activities of the child will develop other psychological problems. Another important thing is to see to it that the child maintains a healthy routine. He should sleep properly, avoid fasting, and during episodes of fever one should be careful, because during these episodes of fever the chances of a convulsion increase. So, but I have, I think, dealt with most of the aspects of epilepsy, but what I have left behind is the social stigma attached with epilepsy. If a child has got asthma, if a child has got a stomach problem, the parent will be forthcoming about it. But if a child has epilepsy, the parents seldom disclose it. They don't discuss it. So there is nothing to be afraid about epilepsy. It's just like another disease. Although ignorance leads to social stigma, one should try to make your child as normal as possible, and that's how we can come out of this curse in the 21st century. Thank you.
Thank you.
Yes, and the school, when the child is attending the school, the teacher should be informed if the child has seizures. More importantly, the teachers should also have a clear idea about the first aid to be provided during the seizures. If they should be taught if the child is having a seizure, the child should be turned to one side and made to lie comfortably. If the child is confused, he should be made to sit and made comfortable. And if there are some emergency medications with the child, that should be administered. In case the convulsion continues, the ambulance should be called and the child should be sent to the hospital. Another important point which is seldom discussed by doctors is about SUDEP, where you have sudden unexpected death in epilepsy patients. Usually epilepsy does not cause death. The convulsions can produce injuries, but it has been found that rarely in epilepsy patients, especially in children, there can be deaths. These mostly occur during sleep and when the child is sleeping alone. So if the child has convulsion, it is better, and if the convulsions are frequent, the child should be supervised in sleep. Apart from this, there is nothing to be alarmed about it, because it is not a common occurrence, but since it can occur, it is better to discuss with the patients especially the parents of the epilepsy patients about SUDEP.